This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. It is Mon Health Live. Thanks for joining us. David Goldberg off today, but Dr. Crystal Atkinson is with us. Doctor, good morning. Thanks for coming on.
Good morning, Kyle. How are you?
I'm doing very well. And our special guest this morning is Dr. James Littles. He's a radiation oncologist. And Dr. Littles, we appreciate your time this morning. Thanks for coming on.
Good morning, sir. My pleasure.
Tell us a little something about yourself, where you're from, and what your specialization is.
Great. I grew up in the Palmetto State of South Carolina. Did medical school at Howard University in D.C. and trained in the metropolitan Detroit and was with the University of Michigan for a decade. I'm a radiation oncologist, and quite simply, I treat cancer patients with x-rays.
Mm-hmm. Okay. So how long have you been in West Virginia and with the Mon Health System?
Just under 2 years.
Okay. So you've settled in, to say the least.
Yes. Looking forward to post-COVID endeavors, getting back to things like minor league baseball et al.
Yeah, the Black Bears. You came in just in time for the Black Bears. All right, Dr. Littles, we're going to get with you about what this COVID situation has done for the cancer patients and what they need to be leery of. But first of all, let's start with Dr. Atkinson. And Doctor, what can you tell us about the latest with the COVID numbers?
So, Kyle, we're excited to continue to see those numbers go in the right direction, going down. But again, we're making sure that we're continuing all of our mitigating issues just to make sure that we don't have continued spread. So across our hospital systems, we're in the single digits as far as patients that are actually hospitalized. We've had we continue to work within the community to be able to provide vaccines to the community, and those numbers can go anywhere from 1,500 people to 2,500 people. One of the things that we want to continue to encourage people is that as the more that we see the demand, the more that we can ask for. So we want to continue to get people interested and focused in on registration, following up, making sure they're answering phone calls when folks are calling to make those scheduled appointments so we can continue that flow of vaccinations coming to our folks here in the community.
Okay, there was actually a good bit of news this week concerning the vaccine, and earlier in the week, the Governor Jim Justice announced that all West Virginians 16 and older are now eligible for the vaccine. And Dr. Atkinson, you mentioned that hundreds are getting vaccinated each day in Monongalia County. Do you have the numbers in terms of how many have been fully vaccinated and how many have gotten one dose?
Not right in front of me, Kyle, but like I said, when we're looking at this right now, we're going at least 3 days a week. So when we're looking at anywhere from 1,500 to 2,500, and we can give those over a course of 1 to 2 days, it's exciting to be able to see those numbers. And we have not seen a lack in the interest of people coming into the community, into the community center that we set up with our partners at WVU
right.
and the health department. So it's really encouraging to be able to see that steady flow.
Dr. Littles, feel free to jump in here about the importance of the vaccine. And again, now ages 16 and up are eligible for the vaccine, and it's very important that everyone follows suit.
When you consider things like the vaccine, and there's certainly a risk versus benefit scenario, and certainly the benefits of the vaccine, in my opinion, and most of the experts far exceed the risk of the vaccine. Certainly, when you think about what I heard this morning, that some of it appears that the variants of the vaccine are the vaccine is able to protect us supposedly from some of the variants and make us less contagious. So there are a plethora of reasons why most people should be vaccinated. And in my patient population, which, a lot of them are significantly immunocompromised, it's far more important.
Mm-hmm. Okay, well, let's go there. With cancer patients, this vaccine, I'll let you speak to it. There's no danger in getting this vaccine. In fact, you highly recommend, even with the cancer patients, they need to be vaccinated.
Well, I think not only do I recommend it, they're probably, they are. A lot of the experts have done studies to show that those patients sort of need the vaccine even more so than the general population, because a lot of them are compromised by the nature of their treatment and by the nature of their disease.
Mm-hmm. And for each of you, you talked about the variants, Dr. Littles, and this vaccine has shown that it's effective against that, but people need to get it. People need to get it as soon as possible to keep these variants from spreading. That's the way that's going to happen. That's the way it's going to be tamped down, the variants, is if more and more people get vaccinated.
Oh, I mean, we have now weapons, and this is, when the virus initially came out, the only weapons we have were social distancing and the mask, and now we have a third weapon, which is a very, very powerful weapon, and it's the vaccine. So, I'm thankful that my wife just got vaccinated about 3 weeks ago, and she asked me, "Well, I can get the vaccine on Saturday. What do you think?" And I said, "Well, let me think about that for a second." And then I said, "Yes."
Yeah.
So let me definitely there are a small subset of people that may have some concerns, and those for preliminarily are people who the small subset of people who had trouble with the flu vaccine, and there's speculation there, but outside of that, most people should, and actually most of my patients are very, very excited about the opportunity to get the vaccine appropriately. So,
mm-hmm. And Dr. Atkinson, you mentioned the community center, and we're talking about it at the Morgantown Mall, where the Sears location used to be. I didn't get my vaccine there. I got my first dose at a local Walgreens, but my wife and daughter both went there, and I was along with them. I drove them there and just observed people coming in and out of there, and they were literally in there for 10 minutes or less. It does not take very long at all. If you have an appointment, you show up at your appointment time. It's very well regimented. People are in and out quickly getting their vaccines.
Absolutely. They've done a fantastic job of keeping the process organized so we can make sure that there's a really nice flow. I also think that, when we're talking about the importance of getting the vaccine, we need to also look at we've had a change in seasons. And so I do think that for people, just to make sure that they have the understanding, is some of the symptoms, such as a dry cough, nasal congestion, a stuffy head, people will pass that off as allergies. And I think we need to make sure that we're really focused in on we've seen just in the past week, people that are presenting with nothing else other than those symptoms, and they continue, and they're showing up as positive for COVID. So I think it's very important for us to make sure that we are, if there are questions, let's reach out to our primary care physicians and make sure that we have those questions answered, because while it sounds like a small symptom, it can certainly develop into something, as we're seeing people with allergy-like symptoms developing COVID.
Okay. One more thing, and we talked about the news with the governor making news, announcing that all West Virginians aged 16 and older are eligible for the vaccine. There was also news on our radio station. Dr. Eddie Campbell, the Monongalia County School Superintendent, was on one of our local programs this week and talking about going back to school full time and students in the classrooms where they need to be. And Dr. Atkinson, I just want to ask you, how likely or unlikely is it that there's person-to-person spread in the schools? The reason I ask this, Dr. Campbell said there's only been one documented case of a student spreading it to another student in school. So the schools are very, very safe.
Absolutely. I think that was certainly some great information to be passed on to people in the community who may have some hesitancy. Certainly it's been a wild ride for the kids being out, distance, hybrid, and now having the opportunity to be able to go back fully. I think the schools have done a really nice job of trying to put processes in place to be able to keep students distance as possible. Again, we've got to think about the same things that we say with the adults. Let's make sure that they're washing their hands, going through the same things that they would do during flu season. But I think that, we certainly, from that piece, we certainly, I think, could have some reassurance that the schools are safe for the students to be able to return.
Mm-hmm. Anything to add to that, Dr. Littles?
No, I think, going back to school is certainly a multifactorial issue, and I have school-age godsons, and from an emotional standpoint, they really needed to be back in the classroom, back with their friends, back playing sports, and just the emotional toll that it took on them this year. I think depending on who you talk to, it has been underestimated. So risk versus benefit again, and I think that it's very reasonable to try to go back to school as safe and effectively as we can, because there's some emotional issues going on with the kids nowadays, from what I understand.
Right, absolutely. All right, both of you stand by, please. We're going to take a break. Stay with us. Mon Health Live on the Saturday morning continues on WAJR after this.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
Mon Health Live for the Saturday morning continuing on WAJR. Thanks for joining us. Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health Systems, is with us, and our special guest on the Saturday morning, Dr. James Littles, radiation oncologist with the Mon Health System. And Dr. Littles, obviously your specialty is with cancer patients. And what measures should oncology patients be taking to help prevent themselves against this COVID-19 virus, especially between appointments?
No, I think they're certainly they quite simply correspond with the CDC recommendations: is frequently washing hands, staying away from large crowds, wearing a mask, and getting the vaccine once it's available. But I think that they should have a higher priority, or they should presume that it's far more important for them to do that, because the virus, unfortunately, could cause a lot more morbidity with them because they're compromised.
Right.
So doing the same thing that everyone else is required to do, but being more meticulous at that, and limiting your exposure, and limiting your times out to grocery stores or restaurants, and just being very meticulous about that and very thorough, and making sure you comply with that literally to the letter, because not only your life depends on it, but perhaps others as well.
Right. When this all started a year ago, were some of your patients reluctant to perhaps come to the hospital to seek care? Was that the case, and has that lessened a little bit now that we've kind of fought our way through this a little bit?
I think it has lessened somewhat, but there are patients that are still concerned, and unfortunately, what that has meant is that some patients have had disease found in a later stage, because of fear of the virus, and that's the catch-22 of having a cancer in the midst of a lethal pandemic. There have been a subset of patients that have had very aggressive and very life-threatening cancers, and because of all the other things that they've done, they were at very low risk of getting COVID or having morbidity from COVID, but they were at much higher risk of having having morbidity and perhaps mortality from their cancer. So there have been a number of consensus papers written by leading physicians within my specialty about some of the things that they recommend us do in patients that are in the middle of a pandemic who have life-threatening cancers. So there've been a lot written about that, and so I've certainly taken the opportunity to read that and modified my practice accordingly.
Okay, well, we've got time here. Let's get into that a little bit. What were some of the suggestions and some of the practices that you've been able to put in place to help these people through this?
Sure. So for a special disease called small cell lung cancer, what we do is sometimes we do in patients that have had an excellent response, sometimes we do prophylactic brain irradiation, and that's treatment of the brain with radiation to prevent the cancer spreading to the brain. The experts, a consensus panel got together and decided that was something that could be postponed during the peaks of the pandemic. The other thing is high-risk gynecological malignancies that had what we call definitive surgery. Those patients could wait up to 3 months to receive their postoperative radiation if within those 3 months there were peak exposures to the pandemic within their counties. The other thing is instead of giving 28 treatments, sometimes we can reduce that to 20 or 15 with the added risk of toxicity of the treatment versus in the peak of the pandemic, the added risk of the mortality and morbidity of the virus. So these were well-written articles. And then when you, just like anything else, there's the art of medicine and there's the science of medicine. And this really took a lot of the experts considering the art of medicine, risk versus reward, and developing consensus. And a lot of the recommendations were 70% of the expert panel agreed on a certain recommendation, and some of it was 95%, and some of them were actually 45%. So that really defined for me the art of medicine as opposed to the absolute science, but they were well written and somewhat easy to follow.
Mm-hmm. Another thing that I would imagine you have to be concerned about is patients' mental well-being, because when you've got someone who is ill, at least over the last year before the vaccines became prevalent, was that you, even if they're a family member, you stay away for fear of spreading this virus. And I think a lot of people probably have been very seriously ill, and they've also been somewhat isolated, and that's an issue.
Yeah, it certainly has. And I think I have heard about times when family members have been critically ill and actually passed away and never really saw their. I know Dr. Atkins can speak on this as well as I can, and that's been extremely traumatic for family members. Not going to funerals or homecoming services and not seeing their loved ones during the last week of their lives. It has been quite an event. Irrespective of oncology patients or not, it's just been quite an event for the entire world.
Mm-hmm. Dr. Atkinson?
Yeah, completely agree with that. I mean, I think that as much as we can do to try to support our families, that's what we've been doing. We, on our COVID units, we actually have iPads in place. And again, nothing takes place of that face-to-face interaction, but in lieu of trying to keep everyone safe, we have put those measures in place just to be able to allow people to be able to FaceTime and allow also the families to have time in the morning and in the afternoons to be able to have updates from physicians and nurses caring for the family members. Mm-hmm. But definitely it's been very tough on all of them.
All right, we are with Dr. Crystal Atkinson, Dr. James Littles, and guys, we got a couple minutes left in the program here this morning. I know, Dr. Atkinson, you want to emphasize that the hospitals are safe, the emergency room is safe. It's safe to return to see your doctors in any capacity because of the protocols that are in place and that have been in place.
Absolutely. We've not stopped any of our screening measures. Anything that we can do to maintain the safety within our organization, we've continued to do that, whether temperature checks, making sure that we are asking appropriate questions as far as exposures, again, to keep everyone safe. Our hospitals, definitely, if individuals are coming in and having to wait, we have cycles where people are meticulously cleaning our waiting areas. So our hospitals are very clean and very safe.
All right. And Dr. Littles, you talked earlier in the show about encouraging your wife to get the vaccine, and I know you probably have a message for people out there listening that may be on the fence. Should I get vaccinated? Are there things to be concerned about? What's your message to those people that maybe are a little bit hesitant about getting this vaccine?
Well, I think the message is clear, and the message has been given, from the CDC and pretty much all of the experts, saying that the vaccine is extremely safe and very effective. So I think, considering that, and the main thing, one of the things to consider about the vaccine is that number two, you're less contagious. Number one, you're less likely to have major morbidity from the illness or even die from the illness if you contract the virus. But number two, and it is a big two, is that you are less contagious. And actually, number three, it appears to be very effective to some of the very infectious and very lethal variants to the virus. So it really is the big three, and there are not many reasons not to get the vaccine.
Absolutely. Guys, great information this morning. We are almost completely out of time, but we appreciate your time. Dr. James Littles, radiation oncologist with the Mon Health System. Thanks for joining us this morning. And
thank you.
Dr. Atkinson, thanks for your time as usual as well.
Thank you so much, Cal. We appreciate it.
All right. That is Mon Health Live for this Saturday morning on WAJR. On